Hi there. Welcome. Come on in and get yourself nice and comfortable. Welcome to Orthopaedics. And how are you today? Okay. Well, I can see here that you're here for a neck and shoulder exam today. Is that right? Okay, well, I have a few questions for you to start with, and then we'll be doing a few exams just to see if we can get to the bottom of what's causing you that pain. There'll be a few movements, lots of checks, and a few neurological exams as well, testing for sensation and things like that. Is that okay? Fantastic. Okay, so if we begin with some questions, then I'll pop on a pair of gloves and we'll start the exams, okay? Great. So, any problems with your head at all? I know we're looking at the neck and shoulders. Any problems, any accidents, any conditions I need to know about? Okay. Any problems with your neck? Problems with your shoulders? And any problems with your back at all? Lower, middle, top of the back? Okay. You tell me specifically about the area where there is pain. Okay. And if you had to rate that pain on a scale of 1 to 10, 1 being no pain at all, 10 being absolutely excruciating, where would you place yourself on that scale? Okay. That's all the questions. Based on these answers, I think we should take a closer look. What do you think? Okay. So what I'll be doing is making notes on the clipboard as we go, so I can put together a report at the end. I'll be making notes of everything though, so everything that appears normal will go on there, anything that's a concern will go on there, so please don't worry about what I'm scribbling, okay? Great. As we go, if you have any questions, please let me know, and as always, if there is any pain or discomfort, please let me know and I'll stop. When we are looking at the areas that are giving you concern, there may be some discomfort, okay? No problem. But as I say, nothing too painful. Are you okay with me touching around your head and neck and shoulders? That's great, thank you. Okay, so to begin with, I'd just like to take a quick look at the head, the neck, the shoulders, just how you are stood in front of me. Just having a look how everything appears before we start touching, moving, anything like that, okay? Great. Sometimes when we have pain in our necks and shoulders, it can be to do with how we're stood, some sort of misalignment, something like that. Misalignment's easy, I can send you to the chiropractor. But sometimes also pulls, sprains, strains, things like that can show up just from a visual inspection, so everything's looking good though, so that's a good start. Is there anything you've noticed? Okay. So what I'd like to do now is take a feel of everything, if that's okay. So, from your head, around the back of your head, down to your neck, shoulders, and then just at the front around this area here. Is that okay? Yep. I won't be touching the front of your throat at all. But as I say, as we're going, anything that's painful or uncomfortable, let me know. Okay, starting with the top of your head. Ready? Okay, here we go. So much like the visual inspection, just feeling now for anything that's a little out of the ordinary. You need to let me know if anything doesn't feel right, if anything feels different on either side. It's going to go around the back of the head quickly. It's great, fantastic. Down around the ears, won't be touching in the ears at all. And down to your jaw. I'll be as gentle as I can. Any discomfort there at all? Sometimes we can hold stress and tension in the jaw, and when we have pain, we can end up preferring it there. Okay, now to the back of the neck. Ready? Okay. Everything okay? Good. Round to the sides as well. Everything's feeling perfectly normal, which is great. We carry tension in our neck and our shoulders as well. So sometimes it can be tricky to see what's tension and what's a strain. Okay, the neck is all fine. Excuse my shoulders as we go. So shoulders next. Ready? Okay, once again, just gently feeling the shoulders, that they feel the same sort of height and things like that. Obviously there will be variation. We're not perfect. Awful world that would be. It's going to come down to the tops of the arms. Everything feeling okay there? Great. Round to the backs of the shoulders. That's great. Little tension there, but that's okay. Fantastic. Okay, thank you. Next, just feeling around the front, so from here round to here, okay? You're applying a little pressure, so if anything hurts, please tell me. But that's great. Everything okay? Wonderful. Wonderful. Thank you very much. How was that? Anything that you weren't expecting? Anything that was uncomfortable? Anything that was painful? Okay. Right. What I'd like to do now is with the neck and shoulders around here, just press my fingers gently on those areas, checking for anywhere that feels a little hotter than the other areas, because that might suggest a little swelling, a little inflammation somewhere. So it's our first indication of what might be wrong. Is that okay? Again, I'll be very gentle because I'll be able to pick up subtle changes in temperature. Okay, here we go. So neck first at the sides. And round the back. Great, thank you. Shoulders. Okay, around the front. Okay. How was that okay? Great. What I'm going to do is the same thing again, but just with these calipers. So, I'm going to very gently just open and close these around the skin. So, little tiny pinching movements, but nothing too much, okay? And again, this is just checking for any inflammation. Okay, all on the shoulders, none on the neck. Okay, ready? The shoulder first. Okay, here we go. That's great. Is it comfortable? Great. And this side, same again. Just gentle pinching movements. Ready? Okay. Good, well done. This can be an odd sensation, but as I say, it's a good indicator as to any potential inflammation. So one more time there for me. Any pain there at all? Okay, thank you. If you need to just readjust, that's absolutely fine. Any problems there at all? Okay. Yeah, we'll come back to this shoulder, I think. Just to be sure. Okay. So next, I'd like you to move your head for me. So I'd like to start by looking forwards at me, and then we're going to look to the left, back to the centre and to the right a few times, just so I can observe that head movement. Is that okay? Great. So, looking straight at me. Any pain or discomfort, please stop, okay? So, looking over to the left, back to the centre for me, over to the right, back to the centre, to the left, back to centre, to the right, back to centre. One more time, looking as far across as you can, over to the left for me, back to the centre, to the right, good, and back to the centre. Okay, how was that? Okay. What I'd like to do is do that again, and this time, as you turn your head, I'm going to have a hand on the opposite shoulder. So as you turn to the left, I'll have my hand on this shoulder, and vice versa. But what we'll do is we'll turn to the left once or twice, and then swap, okay? Fantastic. So, looking straight ahead again, and we're going to look left to begin with. So, I'm going to pop my hand on your shoulder, okay? So, take a look over to the left for me. Back to the centre. Good. Back over to the left. Well done, back to centre. One more time, over to the left. Back to centre. Well done, same thing again, other way round, okay? So, hands going on the shoulder. So, looking to the right, back to centre, good, back over to the right, back to centre, yeah, well done, one more time for me, over to the right again, back to centre, okay, everything okay? Great, just relax for a moment, have a little move around. Let's make a few notes here. Okay. Everything okay? Great. What I'm going to do next is take the reflex hammer and I'm going to be tapping it on your shoulders. Not directly onto the backs of my fingers. I need to know if there's any pain, discomfort, anything like that. Just while I'm busy doing that, if there's anything that doesn't feel quite right, please let me know. Is that okay? Fantastic. So, this shoulder first. Ready? Okay. Here we go. Is that okay? Moving inwards. Okay, is that all right? This shoulder, is that okay? Okay, here we go. Ready? Good stuff. Moving inwards. Last one. How was that? Okay, good. Any pain at all, especially over this side? Okay. What I'm going to do next is just take a few measurements of those shoulders. Again, I'm looking at alignment. Starting to have a few ideas about what the problem might be. So just going to use standard tape measure. Is that okay? Yep. Just stand as you normally would for me, so try not to stand up straight or anything like that. Just relax as usual. Okay, here we go. So this won't touch, so no pain or discomfort. Okay. Fantastic. Other side. Okay. Have you seen a chiropractor before? Might not be the worst idea as your next port of call. I can recommend a good one for you. But I need one myself. My shoulders today. I apologise. My goodness. That's why I became interested in orthopaedics. Okay. Just make a note of these numbers so I don't forget. Okay. Back to those shoulders then. I'm going to place my hand on your shoulders and I'd like you to give them a shrug for me. Is that okay? Okay, great. So, when you're ready, big shrug. Fantastic, well done. A couple more times for me because now I'm assessing whether it's the same on both sides, okay? So, big shrug for me. Fantastic. And again. Yeah. Well done. My shoulders. Next, I'd like you to please pull your shoulders back. So as if you're trying to get those shoulders into the centre of your back. Pull them back for me. Yeah, back to where they would be. Pull them back again. Yep, fantastic. Next, pull them forwards for me, please, like big hug type forwards. Great. Back to a relaxed position. And forwards again for me. That's great. Can you roll your shoulders forwards and backwards for me? So a roll forwards and a roll backwards. You can do them one at a time or alternate like that. Yeah, once more for me, please. That's great. Thank you. Next, I'm going to just take hold of your elbow and push it back towards your back on each side, like that, moving it backwards. Is that okay? Great. This one first, ready? Please stop me if you need to. So, thank you. So, just gently back. Back forwards. One more time for me. Gently back. And forwards. That's great. Same with this elbow. Ready? Okay, so gently back. Forwards. One more time for me. Ready? And forward. Yeah, well done. Next, your left arm. Can you raise it for me all the way to the ceiling if you can? And back down for me. And up again. Back down for me. Same thing with that right arm, please. So, all the way up for me. Back down. All the way up for me. And back down. Fantastic. And then this time, I'd like you to put both arms out and just hold them there for me. Ready? That's great. Yeah, fantastic. Okay, what I'd like you to do is I'm just going to go round the back. So I'd like to just stand behind you, just watch while you hold those arms out again. Is that okay? Okay, fantastic. Here I go. So, nice and relaxed. Go around the back. Ready? Okay, we go. Okay, so arms out again for me, please. And just hold them there for a second. Yeah, fantastic. Yeah, thank you very much. Arms back down. That's great. Thank you very much. How was that? Was it more difficult to hold those arms out than up? Mm-hmm. Yeah. Okay. Right. the last thing I'm going to look at today is a little neurological function. Okay, so what the brain is doing with those sensations. Okay, great. There are a few tests in this part. The first thing I'm going to do is the trickiest one. Okay, so I'm going to be touching along your shoulders and down the sides of your neck with this. It's a tiny, tiny little acupuncture needle. I won't be putting the needle in, but rather just touching along your skin with the needle. And I need you to tell me if you can feel it. Now, it's a very, very light touch, so it's not a problem if you can't feel it, okay? Great, so sides of the neck first, then down onto the shoulders. Ready? Going this side first. Okay, we go. Good. Fantastic. This side of the neck. Good. Yes, well done. One more time. Good. Onto the shoulders, this side. Ready? Here we go. Good. Yeah. Fantastic. One more time. Good. This side. Ready? Okay. Yeah. Great. Last time. How was that? Okay. So tell me, did it feel the same on both sides? So, whilst it was difficult to feel, is it broadly similar? Okay. Next, the same again on the neck and the shoulders, but this time I will be using these. If you've seen these before, these are usually used for massage, but not this time, unfortunately for you. One of these is warm and one is cold. So we're looking this time for the distinction between warm and cold. Is that okay? Great. If you could close your eyes for me this time, please, provided you feel steady, just so you're not sure which one I'm using, okay? Thank you. When you're ready, close your eyes for me. Here we go. Was that one warm or cold? Great, and again. Was that one warm or cold? Fantastic. Other side. Warm or cold? And again for me. Warm or cold? Fantastic. Down onto the shoulders for me. So, left shoulder first. Ready? Warm or cold? Good. And again. Warm or cold? Fantastic. One more time. Warm or cold? Great. Other shoulder, ready? Okay, here we go. Warm or cold? And again. Warm or cold? Great, last time. Warm or cold? Fantastic. You can open your eyes, thank you very much. Let's give you a moment to adjust to the light. How was that? Warm and cold feel similar? Feel similar on both sides of the neck and shoulders. Okay. Next, it will be eyes closed again. What I'm going to do this time is give you different sensations. So we have a very soft sensation and one that's a little sharper. Okay, so I'll either be touching the side of your neck and shoulders with this or with this. Okay, and you need to just tell me sharp or soft. This isn't too sharp, but you should certainly be able to tell the difference, okay? Great, so eyes closed again for me, please. And I'm going to start with the right side of your neck. Ready? Okay, here we go. Sharp or soft? Good, and again. Sharp or soft? Good, last time. Sharp or soft? Good. Other side of the neck. Ready? Here we go. Sharp or soft? Good. Sharp or soft? Good, last time. Sharp or soft? Great. Left shoulder. Ready? Here we go. Sharp or soft? Okay, again. Sharp or soft? Great. Last time. Sharp or soft? Great. Other shoulder, ready? Sharp or soft? Sharp or soft? Good. Last time. Sharp or soft? Good. Open your eyes. Get used to the room around you again. Any problems distinguishing between the two? Okay. So, for my last test, what I'm going to do is around the side of your neck again, and on the shoulders, and on the front down here again, I'm going to be just lightly touching you with these sponges. Like so. Okay? And all you need to do is tell me whether it feels the same. Okay. Can you feel it the same on both sides? So, the texture is the same, the size is the same, and I'll try and make the pressure as similar as I can. Okay? So when you feel them, You just need to say yes or no as to whether they feel the same. Is that okay? Great. Keep your eyes open for this one, that's fine. So, starting with your neck. Ready? Okay, here we go. Okay, good. Again. Yep, one more time. Good. So, onto the shoulders and up this way next. Ready? Okay. Good. Yeah, well done. Fantastic. And then just down onto the front here again. Outside in. Ready? Good. Great. One more time. Okay. So all good with those. No problems with sensation there at all. Okay. So that was the last of the tests. Before I talk you through the results, give those recommendations, is there anything you would like to add at all? Anything that surprised you? Anything that was painful when it shouldn't have been? Anything like that? Okay. Right. Well, everything's looking pretty good. So please don't worry. Okay. I'm starting to think your issue is here in this shoulder, and sometimes the pain can refer. So sometimes you might feel it here when the source is here, might feel it in your neck when it's your shoulders, things like that. Best guess at the moment, that is where your problem is. However, I don't think it's anything too serious, which is good news. What I'd like to do is send you for some imaging, if that's okay. So I will get that referred now for you. And then in the meantime as well, as I said earlier, I'd like to recommend a good chiropractor for you, just to get a few adjustments in that neck and shoulder area. It's up to you while you're there if you get anything else done, of course, but I would certainly ask them to concentrate on that for you, so we can get some help to you quite quickly. Do you have any questions for me at all? Okay. Well, in that case, what I will do is I will get those imaging results done. We'll get you to a chiropractor, and then, once we've done that, come back and see me again, and we'll have a look at those results and look at what to do next. But in the meantime, thank you very much for coming to see me today. Thank you for having all these tests done and being so patient. And I look forward to seeing you to talk through those results very soon. Take care.